good to go. Getting ready to start here. It's about almost 8 o'clock here in Florida, so I think give it about 20 more seconds and we'll get going. Got quite a few people on here tonight. Hope everybody's doing well.
Hope everybody had a nice long weekend. Enjoy your family and time away from work. How many dentists work on Memorial Day? Probably not very many, do they?
Not many. I tell you, it was nice here. It was beautiful weather. So, well, you know, Rich, my clock says 8 o'clock. Can you see the screen all right, Rich?
I can. Looks good.
All right, everyone, welcome. This is Dr. Guy Yatros, and the other voice there you hear is Rich Drake, my partner. And if you have questions, try to type them into the question box, and we'll get to them as we go along, and certainly by the end of the webinar. We've got a lot to get through. We're going to talk about what we consider the 4 pillars of dental sleep medicine. You have them on your screen here: screen, test, treat, and bill. And we're going to give you an overview of those, and then in future webinars we'll get into more detail about them. So there we are. I'm the guy on the left of your screen as you're looking at it, and there's my good friend and partner, Rich. We've been doing this quite a while, haven't we, Rich?
Oh, gosh, I think I've been doing it over 15 years now. So
yeah.
A lot of fun, isn't it?
Yes, and we've been doing a lot of webinars with Keller Labs, and we appreciate their support. We use them for a lot of our devices. One of the upcoming webinars this fall is about which the devices we use, and they do 3 of the 4 that we use real regular, and they just know a lot about dental sleep, and they can help you. This is the one I wear every night myself. My wife keeps her happy to not have snoring and so forth, and I've had that cleared in. I think I had like model number 1. And
right.
I just cleaned it the other day, and it looks just like that again. It's a beautiful device because it's injection molded, it's waxed up, and it's just a great device. And I honestly say this, it's one of the best values in dental sleep. For about $300, it's a really fantastic device. And you all know Keller, they've made the NTI famous as well, and we still use these quite regularly because we see more and more combined therapy with for patients who have TMD problems as well as patients who have sleep problems, and we use NTIs sometimes interim between making their mandibular advancement devices as well. And I'll just finish this, Rich, and let you talk in a second. The last partner we'd like to talk about is KKGI, one of our partners here in the not so fairly recent. I just got a cone beam this year in my office, a CBCT, and we were having a staff meeting today, and I talked about how it's just, you know, it's like you don't know what you don't know until you start doing things a little differently. And I just feel we don't have one in our Tampa office yet. Sarasota's close enough for people to drive here, and I just feel like, gosh, for those patients who won't drive the distance down for an hour to get the cone beam, I just feel like I'm not quite doing what I want to do on my patients. So if you're thinking about getting a CBCT, look at the ones that get the expanded field. This is the one company that I have. Rich, how long did it take us to do this, huh?
People with a lot of brain power. So there's nobody out there that does what we do. So this isn't just about us, but you don't have to reinvent the wheel. We help you do this, and if you're just getting into this, or you've been doing it for quite a long time and you're looking for solutions, everybody has questions, right, Guy? How many questions did you have when you got started doing this? You know, 5 a day. And you got to have somebody you can call. You know, it's like the old Ghostbusters thing, right? Who are you going to call when you have a question? You know, if you've got a mentor that's locally that can help and that kind of thing. But, you know, we're not just software. We are a dental sleep solution for dentists who want to implement this in their practice, who want to find a way to grow it and be profitable at it. And we talk about it all the time, guys. It's very meaningful work. I think it's it just makes you feel good, makes you want to get up and go to work.
And that's what we do, the 4 pillars we're going to talk about today. We help dentists overcome the obstacles. If you can get those 4 pillars, a solution for those in your office, you're going to be well on your way to having a solution for your patients who have sleep disorder, breathing, and apnea and snoring in your practices. And again, that's what we do. We do hands-on courses. I'm going to California Thursday, I think, and you can see some of the other courses, and we're always adding to this, so check out our website. We do 1 and 2 day courses. We do a lot of hands-on things as well. So if we can help you, that's what we live for, is to help dentists succeed in dental sleep. If you're interested in seeing how we can help you, and we're going to get right onto the webinar after this, is just type in to the question box a free trial. And what that means is that we will contact you, we'll explain to you how we can help you. If you're new, or even if you've been doing dental sleep for quite some time and you want to learn how to be more efficient, we can show you how our system, with no pushiness, no obligation, we're convinced after you talk to us, we can show you how we can help with the challenges. And again, these 4 pillars we're going to go over today, we can show you how we can help you take those pillars, and if we consider them obstacles as well, because we got to get them the foundation set, we can take those obstacles from being pretty big to quite small with systems in place. So just type in anywhere along the night free trial, and we'll be happy to someone to contact you, and we'll tell you how we can help you overcome these hurdles. So dental
What are
sleep.
the 4 pillars? Or how do we do this?
Yeah, well, it requires systems. That's what, if you hear one of us lecture, we say the word system, because that's what dental sleep is. And the screening, testing, treating, and billing system is what you need in your practices. And it's not rocket surgery, as we say here in our one of our mixed cliches that I personally like to do, or maybe I don't even do it on purpose, and I just try to make excuses for it. But it's not that difficult. It's just like having a machine. Little parts aren't that difficult, but fitting them all together is extremely important. And here's what happens if we don't. If we don't have this confluence of systems and a system for each of these, if even one of these systems is broken, our practices will suffer. It'll be difficult. We won't be as comfortable doing this in our practices, and we may not want to do it. So there's the pillars. It's if you can get those under control, and we can help you with that, you will be happy to add this to your practice. Rich and I, that's all we do. Is treat patients for this, but we don't think that's where everybody's headed with this. We think that this should be a service that most practices should learn how to do, just like you do a lot of other things in your practice.
Yeah, I think it'll be the standard of care before long. I mean, think back to, I'm old enough guy that I had a dental instructor tell me one time, sometimes you got to hold the tooth still while you prep it for a crown, because of periodontal disease. Well, we don't do that anymore, right? No, we don't. So, and I do think it'll be the standard of care, but think about this: screen, test, treat, and bill, and that's that chain that Guy had up there. And if something breaks down in any part of this, then it doesn't work. So that word you use, Guy, the confluence of the systems, you've got to connect the dots with this. So let's start talking about them.
Well, we'll start with screening, and understand this is an overview tonight. And anybody who's just joining us, I see some questions are coming in. Someone just typed free trial. Feel free to do that. If you have questions, put them in the question box. We are going to get into detail. The next webinar is more detail on the screening and testing and each of these pillars as we do these. So this is where it starts. When Rich and I started doing this was a huge challenge, because we didn't have great screening systems, and we didn't have certainly the access to home sleep testing and some of the things that we're going to briefly touch on tonight to make this easier. This obstacle was what, Rich, probably the reason we started Dental Sleep Solutions, wasn't it? We were looking for screening and testing alternatives, and it was so difficult to get our patients tested back a dozen years ago when we started talking, correct?
There is an awful lot of hurdles. One of the analogies we use, you're going around a football field, the track, and there are these hurdles. So, but each hurdle is also an opportunity. When you think about a crisis in your office and these things happen. So yeah, there are hurdles there, but in the beginning when we started doing this, we didn't have anybody to call. We didn't know who to talk to. There weren't any systems out there to do that. So, we feel like it's your obligation to screen your patients for sleep disordered breathing. Everybody screens for oral cancer, right? Why? Well, that's what we were taught to do. It's the right thing to do. And we're in such a better position as dentists, because most patients go see their dentist at least once a year than their physicians are. Most time we don't go see our physician unless we're sick or we don't feel good. But we talk about the lowest hanging fruit in your practice. So if you have 1,000 adult patients in your practice, there are, what do you think, Guy?
Well, there's
300 of them, at least, probably 300 of them that have sleep apnea and don't know they have it. So we
well,
got to
this,
figure out a system to get them.
Yeah, well, the study, 20% is the most conservative numbers. 30 the percent certainly not off. And if you want to consider just sleep disorder breathing, it's about 50% of that 1,000. So the numbers are staggering. You've got to have a system in place that makes this easy. And I think that's the thing that people get confused about this. And we of course have our system that, again, if you're interested, we'll be happy to share that with you. If you're not screening people, though, you're losing. Not only are you losing the opportunity to help your patients, you're losing the opportunity to gain financially. The system that you want to put in place begins with education so that the team members who are talking about this system understand what we call these red flags, and we're going to go over those right now for just a moment. But then the other parts of the system that you need it to be easy to do, quick, and I like that we'll show you towards the end of this screening part is you'd like to have that system let the patient know, hey, they're at risk. It almost tells them. I think it's one of the unique things about ours. Rich, this is how I started out with dental sleep. You became my partner, my mentor, my friend, and like, Rich, how do I find these people? And we started talking about, well, we just got to start looking at our patients. Well, who's at risk? And look at the numbers here. All you have to do is look at the things on the medical history and understand that there's real valid studies that show that these numbers that we have up here are we're not just pulling those out of the air. They're realistic numbers if you look at the percentages along the medical history.
Yeah, and it's kind of scary. I mean, when you look at this, and remember, these are cumulative as well. So if you have somebody who snores, and they have high blood pressure, and they have diabetes, and they're sleepy during the day, now we're up to 80% likelihood that they have the disease. Well, what if they brux too on top of that? So, think about this list and look at this as you see this, and you think, wow, how many night guards have I made for sleep bruxism in the last couple years? Well, there's a good start. So 50 to 80% of those patients have sleep apnea. How many class 2s do you have? How many men with necks bigger than 17 inches? So one thing you said earlier, Guy, I want to touch on again is the education of your team. So, I mean, we think about how many questions get asked in the dental office. There's 100 a day, and only 7 or 8 out of that 100 are asked to the dentist. The other 90 or so are asked to the staff. So your staff has to be educated on this too. And hygiene is a great department to implement this and do this because they get to spend time with the patient while they're doing that. You may have somebody in your office that takes x-rays, and they may come in and, hey, how you doing? How you sleeping? So, and you're reviewing medical history. So the lowest hanging fruit are these people out there, and what we're going to talk about with the screening process is how do you find those people? How do you identify them?
How do you identify them? You've got to have a system, and the number one thing, as Rich said, is to identify them. The second step of this is those patients have to acknowledge that, hey, I am at risk. So you can't just say, hey, Mr. Patient, you've got AFib. So half the people who have AFib also have obstructive sleep apnea. That was from the studies that we can share with you. That doesn't get you anywhere. You've got to have someone who understands all this and is passionate and can discuss this with the patient to the point where they acknowledge it. And again, if you have a good system in place, it really makes this go much easier. Once the patient acknowledges that, yeah, I might be at risk, I'd like to know if I have a problem, you need to have a way to readily get them tested. And then we talk about treating our patients. I think the biggest mistake a lot of people make is that they try to jump down to the treating part long before the patients even understand they're at risk. So quickly identify these patients, and your system should include some sort of a questionnaire, a system that you can do this in 5 minutes or so. It shouldn't take any longer than it does to screen your patients for oral cancer. And the screening webinar that we'll be doing next, we'll likely talk about that. And the number of patients who have oral cancer is minuscule compared to the number of patients who have undiagnosed, untreated obstructive sleep apnea. And the health ramifications of the apnea many times are more profound and worse than at least equal to the patients. This is the system we use. We have it digitized. Rich and I, how hours and hours we've spent trying to make this easy for people. It's amazing we're still friends, right, Rich? After all the
Oh, God.
debates and arguments over developing how to actually do this.
We tried to make it simple. We put this, you just log in, everything that we do is cloud-based, and you go through a series of questions, and it basically is very similar to what the American Academy of Sleep Medicine does for their screening, and then it assesses their risk.
Right.
And there's something about when you're reviewing medical history and you are asking these questions and you're looking for these red flags, I think that's good for the doctor. But that's not always so good for the patient. This is what's good for the patient. This is what helps the patient see. This is what helps the patient acknowledge that they may have a problem. So when this computer screen comes up and it says I'm at severe risk, I mean, what do you hear, Guy? What do people say?
The best thing to do, first of all, is just be quiet and let them, and he who talks first loses. And then they look at this and they go, well, what am I at risk for? And that's what you really want when you're communicating with your patients. It's a subtle difference between telling and asking, but it's a huge difference. And if we can get our patients to ask us questions, we're far further down the road of them listening because they've asked for an answer to something. Now we're telling them instead of them telling them something before they're ready to hear it. And that's one of the beauties about if you have a system that they self-discover they're at risk, and then you have qualified people. Maybe it's the dentist, maybe it's what we call the sleep ambassador, or maybe it's just your hygienist who's really taken an interest in this, who can discuss this with them and explain why they're at risk. Any reasonable person's going to want to see if I'm quitting breathing at night. I had a patient in today, Rich, just to say how serious this is. He was talking about he's on a CPAP and he wants something for travel, and he was mentioning his buddy went home, took a nap during the day, and died in his sleep, had apnea, so it just lasts in this year. So, I mean, we have examples of that all the time, and this is why it's important to be involved. And if we can get a system that's just this quick, it takes these patients less than 5 minutes to fill this out. And if you've got someone who's versed at discussing it, a lot of times the discussion goes fairly quickly to where they're ready to move on to the next part and discuss the test. I'll take a little break on this. We'll review in a second. Just for people who came in late, there's some questions coming in. Go ahead and type in your questions. If you have any, we'll get to them before it's over. And anybody who really wants to see how this works with the free trial, you type that in. And we also, the courses, I think I forgot to mention, if you want to come to one of the courses, we do offer a couple $100 off the 2-day courses. I think it's 100 off the 1-day courses, or 50 or something like that. Just type in course and the city you want to do it. We'll put it back up later, and you'll get a discount if you put that in before the webinar's over. All right. When it comes to reviewing this, Rich, I mean, this is all it takes. Is you got to be concerned. You've got to understand the red flags. And the big one I don't like is I don't say the big words like apnea. I mean, if you did an oral cancer screening and you thought someone may have a cancerous lesion, do we say, hey, Mr. Jones, I think you might have
squamous cell carcinoma.
I think you may have cancer. Let's send you to an oral surgeon and have it looked at. No, we're not going to do that. We're going to be concerned, and we're going to convince them to get that looked at, but we're going to not give them a diagnosis before they have a diagnosis, right? We need to.
Yeah, and I think the important thing, like you said, Guy, is you get better at this as you do it more and more, but don't talk too much. Don't be afraid to have a little bit of silence. So when somebody looks at that screener and they say, wow, what does this mean? I'm at severe risk for what? Well, all of these questions are designed to assess your risk for sleep disordered breathing. Is your airway closing down at night? So you answered yes to how you snore, and we have a little button in there that you push, and that's where we kind of review the screener and we go over that. And like you said, Guy, I think most dentists are very caring people, and they care about their patients. And the comorbidities, those are the red flags. Well, you've got high blood pressure too, and you're pre-diabetic, and these things. And like you said, don't put the cart before the horse. We don't even know if you have sleep apnea yet. So, the first thing we really need to do is get you tested. And what's even better than that, like you said, Guy, is the guy saying, well, how do I know if I have it? Is there a test? Well, yeah, actually there is. And this is one of those links in that chain. What did we used to, let me tell you what I learned 15 years ago, Guy, the very first course I took. It wasn't screening. It was, hey, if some big fat guy walks into your office and he snores while you're giving him a shot, it's not because you're a good dentist. It's because he's got sleep apnea. I used to think that was because I was a good dentist. And you just told him, hey, you need to go get a sleep study.
Right.
Well, that chain breaks right there. So you have got to have a system for we're moving now from screening into how we're going to test these people. And it can't be just, hey, go get a sleep test. So let's talk
No.
about how to do this, guy.
Yeah, and this has become a whole lot easier as we've progressed, because when Rich and I started this, the only answer was, we'll send you down the road to the sleep lab, and you're going to spend the night like the guy here or lady here on the slide, and this was on the right side here. That was your only choice. And now there are choices, and we still do use the in-lab tests, and we'll talk more detail about the test in our next webinar. But just understand there's PSGs, which stand for polysomnogram, and we have home sleep tests, or another word for those are ambulatory tests, and those are done at your house. And the verbal skills I think you taught me, Rich, are the patient says, yeah, I understand, I'm kind of concerned, I'd like to know if I'm suffocating at night. How do I know? And we say, simply enough, we just got to measure your breathing. We got to measure if your oxygen is dropping down. And we can do that in the sleep lab, like it's been done for years, or we can do it at home. Which way would you prefer? Give them those two choices, not do you want to have a sleep test? It's one or the other.
That's
And
kind of like asking your boy Nicholas guy, hey, do you want to eat your vegetables? You go, do you want broccoli or green beans tonight,
right,
right?
absolutely, and that works for him as well. So, there really is two ways we can get tested: PSGs or home sleep tests, and those you can work with a sleep lab, and you can send the patients to get the PSG, or some of the sleep labs actually provide home sleep testing as well. We'll hit on these three ways of getting home sleep tests a little bit more in just a second, but there's really three kind of categories we put that in. You can do your own personal device that you own in your offices, or you can work with a company that ships these devices, or you can work with a local physician or physicians who dispense these. And the first two come with a little bit of caution, which we'll talk about in just a second. I think I'd like to talk first of all about, do you feel that maybe we're giving our patients less than the standard of care treatment by giving them a home sleep test? We do a lot of courses, and that always comes up. Yeah, but the home sleep test is not the gold standard. It's not as is it not as accurate? Are we gypping the patients out of a better treatment than they really should have by doing this? And I don't know. What do you think? Is this the way you're going to spend your night, or would you rather spend your night in the comfort of your own home with a piece of equipment that kind of looks like this?
Yeah, I've heard guys say, a guy back in the day when I go, PSG, by the way, stands for polysomnogram, which is the in-lab test. And I remember some guy saying, they videotape me while I sleep. It's like, I don't know what I do while I sleep. So there's a lot of reasons, that people don't want to go to a in-lab study. But we have options now, and this is where we really need to collaborate with our physicians as we do this. Most of the time, which tests patients get, Guy?
I do. It's the one.
It's the one their insurance pays for, right?
Absolutely.
Yeah.
Absolutely.
So let's not overthink this. Sometimes it's just that simple.
Yeah, and the argument really is that which one's
better?
which is more accurate. We have opinions. You can develop your own, but I think if you read these next two lines, you can make your own assessments out of it. And I think every time I've shown this, no one's ever said, well, that's not true. I mean, I do believe that a PSG is a little bit more accurate. You've got more data. You have people watching the patients, but it's a less accurate night's sleep. You don't sleep as well when you're all strapped up to all that stuff, and the guy's video recording you next door, and that you go to bed at the time they tell you and you get up when they tell you. Well, a home sleep test has a little less data, so it may be less accurate data or less accurate tests, but you have a more accurate night's sleep. We sleep deeper, and if you sleep deeper, you're more prone to apnea and airway issues. So there's not any perfect way of doing this. When you combine those two, I certainly don't think a home sleep test is any less of a good test. I mean, I personally am a fan of home sleep tests, and again, like Rich said, it may not be our decision. But I can tell you this for sure, Rich, because we were doing this back when only show in town was PSGs. Do we get more people to be tested now more easily than we did when we didn't have the home sleep test option?
I would say, Guy, that we have taken the hurdle and cut it down in half in size. Again, that analogy of the hurdle. Some people can't jump over that hurdle, but if you lower it by half, and that's what we mean. The testing part of this is a big deal. So remember, we've screened somebody, we've identified them, we've assessed their risk as being moderate to severe, and now we're talking to them about getting tested. Each one of these things is somewhat of a hurdle, and I think everything is working together now to make it easier for us as dentists. Don't
Absolutely.
you think, Guy? Yeah.
It is, and so if we're talking about home sleep test, I'm just going to briefly talk about this because we'll go into more detail next time. You can own your own device, and you can have physicians read that after you collect the data. You can work with these companies. There's companies that we partner with. We have a lot of partners at Dental Sleep Solutions and DS3, and these companies can mail the test to the patient, bill the patient directly, have board-certified sleep physicians who read the test and deliver an interpretation, in some cases a diagnosis. Now, if you've got a physician locally, everybody can do that. You can work with a physician, refer to them, let them order the test. Options number 1 and 2, there are some laws that starting as kind of a moving target. Federal laws, Medicare prohibits those in most cases. Some state laws do, but for the most part, other patients in most states, that may be a feasible way of doing it. Again, we'll go into more detail in the next webinar about that, but understand there's not just one way to do this, and with the availability of these options, and addition to the PSG, if you still want to do those, getting patients, you said cut in half, I really think it's probably a third or a fourth. It was one of the biggest hurdles to sleep, a diagnosis in general, and certainly dental sleep, and it's greatly reduced. And if you consider for our DS3 members that you can actually just click a button to work with some of our third party, not third party, but our sleep testing companies. Yeah, it's a click of a button, and the information is transmitted to these companies. The information comes right back in DS3. And yet another reason, if you want to do a free trial, just type in free trial, and we can show you how slick and easy that is to work for some of your patients. I don't use it for all my patients. I still work with physicians in my area, but man, it's awful easy to just hit that button, and then the data comes back in. I can track in real time where the patient is, because the home sleep testing company updates the status of the patient and where they are with getting their test and
That's
read
pretty cool, isn't it? We've come a long way from going, hey, you need to get a sleep test, and then 3 years later they show up and go, yeah, what happened? Oh, I thought about it, but I never did. So I think one of the things I want to add too, Guy, is that as dentists and hygienists and staff people in the office, you need to create some sense of urgency in these people. We talk about mild, moderate, and severe sleep apnea. You know what we're doing in my office, Guy? We're trying to change that to grade 1, grade 2, grade 3. Kind of like they do with cancers,
Right.
Stage 1, stage 2, because we don't think of mild as being that bad, but mild sleep apnea still kills you. So you have to create this sense of urgency. So when you're screening and you're testing, what we typically do, Guy, is we make them an appointment for 4 weeks. We help facilitate that test through the clicking a button, or we collaborate with the physician, whatever it is that we do there. And then so what that does is it puts some accountability on the end of it. You're going to come back in 4 or 5 weeks, and we're going to spend 10 minutes, and we're going to go over your sleep test, and we're going to talk about how to treat it, which is where we are now. So let's talk about how to treat it.
Yeah, and I see some more questions are coming in. Rich and I are trying to type in as we go, doing 2 things at once. So if we don't get your question immediately, we will get to them before at the end. We'll be finished a little bit before the end of the hour, and we'll have time for questions and stay on as long as necessary. So don't worry, keep typing the questions in, and we'll get to it. The treatment part. This is probably the part that dentists are most comfortable with, because treatment of dental sleep is not that different from dental treatments. We're putting doing exams. We're putting acrylic in people's mouths. We're doing ranges of motion. I do have to say that again that you've got to have a system for doing this, and the dental softwares, the dental systems they're built to house dental things. And really, this is dental sleep medicine. It's a type of medicine we're practicing when we do this. And it's, some people say it's apples and oranges, but I think it's more like apples and anvils. I mean, it's not even in the same genre of anything that dental sleep and dentistry. It's you've got to have a system to manage sleep tests and all the things that we do. And if you get that down, and you have a system, and you have staff members who are trained. I'm just a big one on believing that your team members are capable people. We want to hire smart, hardworking, capable people and let them do their jobs, and if they'll be happier than if they're just sucking spit their whole lives and or just doing the remedial jobs. Let's give them some responsibility. And if you look at these steps, is there anything hard about any of these, Rich? I mean, they're just little procedures. They're just steps.
Well, I think that's one of the things that we have done so well, Guy, is that we have broken this up into little bite-sized pieces. And I mean, we have a lot of members now, and they are doing very well, and they're very successful. But you got to start somewhere. I mean, you think about doing a filling. Well, you know, at one point you stressed over it a little bit, and as you we just can't stress enough that you don't have to reinvent the wheel here. I think you've got some more slides in there, Guy, about some of that stuff. But
yeah, and I think the point on this too is if you have the systems in place and you've got some team members that can do this, this doesn't have to take a lot of your time. I spend less than an hour of my time per patient from consultation to treatment complete, truthfully, it's closer to 30 minutes of time. I can easily say that for our members and people that we can help, and if they follow our system, they'll be able to do this in less than an hour of doctor time. Now, there's some staff time involved in that, but it's not something that's going to suck a lot of the dentist's time once they understand it. Because look at each of these steps. There's nothing difficult about it. But again, it's like that chain. If you have a missing step, then the next one's a big leap, right? And we can help get you to understand the systems that you need and make you very efficient at doing this, because nothing is complicated here. Talking about the treatment, one of the things that I harp on all the time to my team, and certainly when I teach these courses, that I saw one of the questions that ask about what cities the courses are. We'll be putting that slide up at the end too, so it's not too late if you want to get signed up for one of those courses. We'll put that up for you in just a few moments, as well as talk about the free trial a little bit more. If you're interested, just type that in, and we can call you and let you know. What I talk about in these courses are that, look, if you have these things before the patient walks in, if I've got a sleep study, and again with DS3 you just hit the button and it comes right back in, so that's easy. And maybe the patient had a sleep test somewhere else, so we've got to call them, we got to get some important data out, which is part of the learning curve, and we can help understand what data you want to look at. We want to also look at what the patient's symptoms are. Are they snoring? Are they tired? Why would they want to put a CPAP on? Why would they want to put a dental device on? What's motivating them? And then they want to know how much is it going to cost. If we have all these things figured out, we've not put any of my time and very little staff time in, and the patient can come in for a very, very productive consultation. And I don't know what your numbers are, Rich, but we get over 70%. It right hovers around 3 out of 4 people that I see for consultations go ahead with treatment.
I think ours is 72%.
Yeah, I had to
no,
beat
I'm kidding. I'm kidding. I just had to beat you.
Whatever yours is, mine's 1% more.
Yeah, exactly.
but
it wasn't 10 years ago, though, was it, Guy? I mean, we're getting better at it, and that's what we're trying to teach you guys is that kind of stuff.
Yeah, and when it comes to patient exam and the further modules, and for those who came on late, we're talking about the 4 pillars of dental sleep. We're a little over halfway through with the end of the treatment. This is just a big high-level overview. We're going to get into the details in subsequent seminars that are, or webinars rather, that are coming up each month for the next few months. You need to do a little bit different exam. That exam's just slightly different than what we would do. We're looking at things like their tonsils, and we're looking at their maxilla and mandible. We're looking at with a little different set of eyes. And we talk about which devices we use where in that upcoming webinar. We're going to talk about why certain arch sizes, maybe a certain device works better. If they can breathe through their nose, What's their soft palate look like? These type of things can affect whether they will be successful with treatment and also which device we do. So again, a big high-level overview. We do a little bit different exam, and we have templates to help with that exam. That exam used to take me about 30 minutes. Wrote out a big long SOAP note until we had systems in place to where we just have check boxes and we just look at those things, and it kind of directs us in the direction we're going. And I don't know about you, Rich, but we schedule 10 minutes of my time for the exam and bite appointment. My team does a lot of these things on here, the photos and so forth, but most of which is something that team members can do. And even with that, it's still less than an hour of appointment to even getting the impressions and everything that we need during the initial exam, appointment, and device selection. Sorry.
Yeah, well, you've trained your staff well, Guy. You invested a lot of time on the front end to teach them how to do a lot of that stuff, and that freed time up on your back end. But that's what we recommend that dentists do. But the point I think that Guy's trying to make is this doesn't take hours and hours and hours of time. It's got a starting point, it's got an end point, and that we've tried to break it up into steps, and it's very rewarding. We were sitting in my office today, and Dr. Yarbrough was doing a follow-up, and this lady said, "Man, I'm like helping my husband out in the garden now, and I'm weeding again, and I'm going for walks, and they just start to engage life again, and it's very rewarding to hear patients talk that way."
Right. So after we do the exam, we just take a forward protrusive bite. We use one of these two gauges typically. There's other ones out there to do the bite. Pretty self-explanatory. We'll talk about that again in further subsequent webinars. The bite takes about 30 seconds to take. We decide which device we're going to use, and then we see our patients for some follow-ups. And the goals of the treatment, I think, are the most important thing that we need to establish with our patients prior to beginning treatment. And if the patient understands these three goals, and we have a clear understanding of the goals, and they understand where we think that they may end up, we'll be much better off. And the first goal, or first step, there's really two goals in one step I have on the slide here. The first one is they have to wear the device, and we discussed that with them at the consultation. Look, here's the different devices, and as we do the exam, we talk about why we think this device might be better, and they need to kind of buy in to the device and say, yeah, I think I can wear that, because nothing else really matters if they won't wear it. And most people do wear the devices. So we have a far higher compliance rates than with other forms of treatment like CPAP. And then the second goal of treatment is we want to make sure their symptoms are better, that they improve the snoring, the sleepiness, whatever the thing that drove them to look into this in the first place. And then even if they're feeling better, we got to do follow-up sleep testing to make sure that they're at a reduced risk from a health standpoint. So we make that fairly easy by the steps and the systems that we have in place. Rich, when do you do your device check now? Because I know we at one time didn't agree on that.
All right, you convinced me. I used to do it at a week, and guys said, well, what do you do that for? You hear about the little problems they had. We do it at a month now, and we don't hear about any of that stuff. We tell them that they're going to expect this and that, and they're going to have a few issues. And if you have something that you can't get over, well, you certainly need to call us. And we're never more than a phone call away. But we're out at 3 or 4 weeks now for most people, and you're right. It's worked very well.
Yeah, and I'll put everything up on the screen since it is kind of an overview here, but so you can see how we go through this. The goal is to get subjective and objective success. And if we're not where we want to be at that first device check, and again, I agree with Rich, and we do it about 3 or 4 weeks down the road after they've gotten used to wearing the device. We go through a system that we have of asking the questions about their sleep and their sleep quality and other sleep issues, and if we feel like that's acceptable, then we're going to move on to the sleep test. Oh, sorry, I didn't mean to hit that. If we're not acceptable, we're going to work with the patient about what we call titrating the device, moving the device more forward to where we get to an acceptable level. So we may have another device check and go back in this circle here. Once we get to the acceptable level, with symptoms, which usually happens the vast majority of the time we get to that level with our patients, then we're going to do a sleep test of some sort, usually a home sleep test or whatever type test they had originally, to try to do apples to apples if we can. And as long as that's acceptable, we're going to see our patients about every year. But the first check, we typically see them about 6 months first, and then annually thereafter. And again, is there anything complicated on this? It's not. It's just making sure you have a system and follow through with it. So treatment. This is, someone typed in, what does DS3 stand for? It's Dental Sleep Solutions Software, or even, we've actually incorporated to have two meanings, because we do have a really fantastic web-based software that you can trial for free. Just type in free trials, we mentioned earlier. But we also call it Dental Sleep Solutions System, because the software is the backbone for the system we have. And no matter how you're going to get involved in dental sleep, you need to have a way to manage the things that I have on the screen. I don't have time to go through each of those individually. Again, we'll touch on more of these in subsequent webinars. But can you see that this is different information than what you have in dental softwares, dental systems that are out there? Okay, let's go forward here. Going to let Rich talk for a second, maybe. Sorry, I get on a roll there, Rich. I'll get off my soapbox, but
well, there's so many questions coming in, man.
You're typing them in. Yeah, good.
Typing. I'm trying to answer. I'm trying to get you guys all answers. So
good. I'm glad you're answering. The system that you're going to pick to do this, it needs to be separate. And one of the questions come in that a lot of times is, well, why don't I want to use a separate system? And there are really good reasons for that. There's three on your screen here. One, and really important, how many people, Rich, you've known multiple people that have been audited by medical insurance companies, and boy, it would not be great if they could look through all my dental records and my medical records, and the record keeping is totally different, right, for medicine versus dentistry. And so you don't want to confuse the auditors by having that data mixed, and for legal reasons as well. We use our own accounting for this. When I had my dental office and I was doing both, we have a few more write-offs. I mean, what do you do when a patient really needs your help and they're in dire needs, that you're afraid they actually may die or may have really serious health consequences if you don't help them? They can only afford so much. We do more write-offs because of that in our offices. And then, the last thing I was really glad I did was I separated my sleep practice from my dental practice. So at what point, when I decided to bring a partner in to my dental practice, I had some separate accounting and so forth. So there's three good reasons. There's more than that to do this, but having it separated and having a system that does it is entirely reasonable.
Well, the flip side of that too, Guy, is there isn't anything out there. There isn't any software out there that does dental that also does sleep. So you all need to know that we're talking to some of the major players in the industry about trying to incorporate a sleep module into what they do. But right now, nobody has that. So that's another good reason to do it separately, because if you put in the free trial, you get to see it. We're not high pressure. We're not big time sales pressure. But you get to see, where do you put a sleep study?
Yeah.
If you're using SoftIn, I mean, how do you subjectively test these people? How do you screen them? What kind of notes do you put in there? There are just so many things that are different. And the electronic medical record, the insurance payers are going to start penalizing us as dentists if we can't show that we're using an electronic medical record. They've extended that another year, and who knows if they'll keep doing that. But the push is that we need to do that. And if it's cloud-based too, can I tell my story, Guy, about driving to the airport and there's so much smoke I couldn't see across the road, and when I got to Dallas and turned my phone on, one of my buddies goes, "Rich, I'm at the gym on the treadmill and I'm watching your office burn down, on the news." And like, holy cow. But I didn't lose, anything, because everything in DS3 is backed up in the cloud. It's a cloud-based system. So that's a lesson for all of us, right? Everybody thinks that never happens, but you got to back it up. You got to take it off-site or do it online.
Thank God you had it backed up. We could make that a really long story, quite the story that you told me when that happened. One question came in, is DS3 an EMR? It absolutely is. It qualifies for that. So that's, again, the reasons to have those systems in place. And again, uh, I like this slide. I made the slide not too long ago. Rich was like, "Wow, it's a cool slide," so I'll show it to you again. But it
Either way.
it really shows if you have we've got the four pillars. These are subsets of things that you need to have a system for in your office. If you have each of these little steps figured out, it's easy. It's the easiest thing you'll do in dentistry. Just a matter of putting the steps in order, and you can spend about 45 minutes of your time, and you can take care of this. All right, we're again at the high level overview. I know more questions are coming in. We're getting to them. Thanks, Rich, for typing those in, and we'll get to all of them, but we're going to end up on time here because we're 45 minutes left, and we're on to the fourth pillar. How about that? Billing. Is this one important? I,
I
I
don't
think
know. Last time I checked, we got to get paid, right?
it is a business. We want to help people, but at the end of the day, it's a business, and your staff is going to love doing this. There's nothing more rewarding, and we may be biased, but I mean, I've been a dentist for pushing 30 years, and I've done all kinds of dentistry, from pediatric to nursing homes to having my own prosthetic dental practice, and I can personally say I've never done anything that's more rewarding or enjoyable than doing dental sleep. But and you may get your team all excited, but when you come back and tell them you're going to have to start dealing with medical insurance, they may feel like this is what you just threw on them, that this is too much to handle. And what we should mention is, it really becomes your obligation, if you're going to get involved in this, to manage the insurance. It's not something that we can just say, I'm going to wash my hands of, because you owe it to your patients to try to get as much coverage as you can for them, so that more people will do more treatment and you'll help more people. I mean, it's just that simple. Um, as these slides look familiar to the dentist out there. I don't know if you've seen this new slide, Rich, that we put together here, but I just did this pretty recently. But it's been a long time since you did dentistry, because Rich has been doing just dental sleep for pushing 15 years now, I guess. But
Yeah.
you recognize what this stuff is, Rich? Were you trained for this?
What what is that thing sticking in that guy's tooth right there, man?
I think
That
that's an
bottom
endo
left.
file.
That's
I quit
disgusting.
I quit doing that a long time ago. But the point is, we as either dentists, or there's some team members on here tonight, we were trained to do x-rays, cleaning, crowns. Now we're doing implants as a state of the art, and we feel comfortable doing that. We should do that. And then the next slide I have up here are other things that some of you probably do. Some of you probably do your own plumbing. I gave a lecture in I don't remember where I was last lecture. I think out in Arizona is where I was. And, I said, does anybody fly their own plane? Well, lo and behold, someone flew their own plane there. But everybody didn't, and everybody doesn't build their own house, if you look up here in the upper right. Some people may do their own accounting, but, why would you do your own accounting if there's people who maybe can do it better? If you're going to get sued or some have to go to court, are you going to be your own attorney? Are you going to represent yourself, or do you think maybe now's the time to call in the experts for you? So my point is, I doubt that anybody listening out of the hundreds of people on here tonight that does all of these things, because there's people who are trained, they're knowledgeable, they have the right tools to do this every day. And so the point is, if you've not been trained, you don't have the right tools, what makes you think you're all of a sudden an expert at medical billing? Because medical billing is a whole different animal than dental billing. And we can help you do this, and we might encourage you to learn how to do it. But if you have no experience in it, the quick, easy answer, and we're going to do a whole webinar on billing, so don't think we're just shunting this off and saying we're not going to teach anything. We will. But the quick, really answer is, use a company or a third-party biller that can help you. There's
For a living. Yeah, that this is their area of expertise. You got to remember, we're crossing that line. I think that might be your next slide, Guy,
there it is.
from dentistry into medicine, and it's not the same. It's just not. The patient's perception is different. The plans are much more complicated, and they're different. So if and we work with a lot of third-party billers in the DS3 system. We give them back office access to that, so that you don't have to duplicate your efforts on a lot of this stuff. Yeah,
Right.
the billers that we work with, they have access to through the back office to what's there, and it makes it work a whole lot better. We had a question earlier too, guys. A good point to bring up. Is DS3 abreast of, are we in tune with everything that's going on with the state and the laws and the billing and stuff like that? And my answer was, so that everybody can hear. The state laws are changing. In Texas, they say, well, you have to work with physicians and you have to have 12 hours of CE, and 4 of it has to be hands-on, and that's just happened in the last month or so. So what we tell dentists is contact your state board. Are there any restrictions on how I can treat sleep disordered breathing, snoring, and sleep apnea? And just get it straight from the horse's mouth. And then if you work with a third-party biller, they're going to make sure that you're in compliance with this. If you, guy's one of the experts on, if you want to bill a certain code, well, medically, what do you need to document to justify billing for that code? Those are complicated things, and that's why we say use a third-party biller. But every patient sits in my office, Guy, they have the same 2 questions. Every single time.
Probably the same in every office in the country.
It's not what shampoo do you use, Rich? How do you get your hair to look so good? Yeah, how much does it cost, and what does my insurance cover? And again, this is another one of those links in that chain. And if you don't have a good answer, then you're not going to close 75% of the cases like Guy does. If you go, well, I don't know, I mean, just pay me. How much money did you bring? Pay me $5,000 and we'll find out what insurance covers. Patients' perception and how they deal with medical insurance is just so different. And it's been that way for what? The physicians have been training patients for 30 years,
right?
That they don't have to do that. So, but insurance decisions, you got to decide what you're going to do with Medicare, right? You got to decide if you're going to be in network or out of network, and you have to have some kind of a system to bill for this. Are you going to accept assignment? Are you going to do this? And of course, you always bill for medical. So right. Tell us, what are my options for Medicare, Guy?
Yeah, and again, for anybody who tuned in late, this is the high-level overview. We'll go into more details in the future. You really have to make a decision. You can opt out, which means I'm not going to bill Medicare and my patients pay me out of pocket, or you can become a provider. There's 2 types of provider, a participating and non-participating provider, and there's different reasons for each of those. The quick answer on that is we recommend today that you become a non-participating Medicare provider. We'll talk more in detail about that, but by doing that, you do get your patient some benefits, but you're not locked into the Medicare amount in your area. So if that's not enough for you to be happy to do this all day long, you get your patient some benefit, they get some money back from Medicare and their supplemental insurance, but now you can go on and balance bill them for whatever you need to make it worth your while and run your business the way you need to run it. So when it comes to billing systems, I've been down the gamut of these where we do fee for service. My private practice was Island Dental Spa, and we had really high-end treatment, and everybody's fee for service. And I tried that in dental sleep, and it works fairly well, but not the less that patients have to pay, the more I'm going to do. You can do accept assignment of benefits, which means I'll take the insurance money and work out the difference, and there's fixed ways of doing that, and there's more of a flexible system that we can go into. And Rich already mentioned the billing the codes. You want to keep it simple, just bill for the dental device, which is the E0486. If you want to bill for each appointment and evaluation of what management codes they call, evaluation management codes, then you better darn well make sure you're using the proper system and documentation so that if you get audited that you won't have to worry about it. So good news is it's doable. There's experts to help you, and nothing's more rewarding than to help these people live better, longer lives, and get paid for it. We do well, Rich and I. That's all we do is dental sleep now, and we're sitting in my nice house here, and it's paid for by the money we make from seeing our sleep patients. You could add income to your practices by doing this. If you just get these 4 pillars secured in your practice, have a system, accountability, and a way to manage that. Can't ever recall talking to a practice that said, dental sleep's just not taking off for me. It's just they're having issues. And if I start talking to them, or that's what we have our whole member support expert team. That's just all they do is help these dentists.
We find places where that chain is breaking, don't we, guys?
It's one or all these pillars need shored up. That's really what it boils down to. So you got to have a plan for success. It's not something that is as simple as making a piece of acrylic and having someone's jaw move forward. That's actually the easy part of this. The rest of it is systems in place. And I can tell you, there's nothing more rewarding. I'm sorry, I have to leave that up there for a minute. Dental sleep is very less, I'm going to use a double negative, I think, but it's a whole lot less stressful than dentistry by most every way you can look at it. I remember what you told me, Rich. When I sold my dental practice, now it's been 2.5 years ago, and you've been doing just dental sleep for a long time. And I don't know if you recall what you told me, but you said you
I
don't. You go ahead and tell me if you remember. Go ahead.
I told you, you don't realize how much stress you're under.
Yep.
And you won't realize that for 6 to 12 months. In
Yep.
6 to 12 months, you'll go, wow, you're right. I didn't realize that. And it's just hard working on patients, that when you got to give them shots and do all that stuff. I mean, I know some of you feel the same way. I was a good dentist. Guy was a good dentist. I'm sure most of you out there are good dentists. And you do a great job at this. But we're trying to get our arms, help you guys get your arms around the opportunity that's here. It is
Right.
so much bigger today than it was when I started 15 years ago. I didn't have anybody to call. Nobody could answer a question. Guy, can you go back just a couple slides to the 4 pillars again? I wanted to make one more comment about that, because we had several questions. People come in, well, how's yours different than other softwares out there and systems and things like that. And we have built-in webinars and teaching tutorials that you can actually view from logging into the software, and then you answer a few questions and you get free CE, when you're doing that. So we have an hour on each one of these topics or more when you do this. So again, I know you said it before, Guy, but this is a high-level overview. We are going to do other webinars. I think we've got that schedule somewhere up there too,
It's coming up.
where we're going to talk about some of these other things, but we wanted to make sure that we get that point across.
Right. And here's how you get a hold of us. I got a couple of the slides about the courses coming up. And one thing I want to emphasize is we're not promoting that you get out of dentistry. Most of you won't. But man, it is really rewarding to have some of these sleep patients in between your practice, break up your day, and have a little less stressful procedure that you're going to perform that's going to be highly rewarding and profitable. DS3, Dental Sleep Solutions software, Dental Sleep Solutions system. Here's how you get a hold of us. I'll put that slide back up in a few moments. Again, for those of you who showed up late, you want to see how we help with the webinars, with the educational opportunities. We have a whole 2-day course, Rich. I don't even know if you know we have that in there. The whole 2-day course is available online. You can watch. So our member support expert team is there to answer questions. We're proactive about your getting involved in dental sleep. And if you want to just talk to us and see how we can make this an integral part of your practice, and then just type in free trial, and we'll be happy to talk to you and get you set up and show you how we can do that. And you can just use this and look at it and see, and you'll get well worth your time and energy just from taking the time to go through that. Another free thing you can look at is go to dentalsleepinsider.com, and this is our monthly online magazine. No costs, won't ever be a cost. It's free to you and your team members. There's really practical things. I think the thing we try to, our whole mantra is we want to make this easier for our offices to do. We want to make it practical. We don't want to take something and make it more complicated. We're trying to make it easier. And there's great articles about how, just tips. We have videos in this online magazine, and it comes out once a month. And just sign up for that, and you can absorb the knowledge that we have there. So you go there to sign up yourself. This is the webinar series we're doing with Keller, and that's the next one coming up on June 28th. And this, we're going to go into detail about the screening and testing. So we hit the higher level overview this time, and some of the questions that came in we somewhat answered today, but we'll have a lot of time to dive deeper into that. And here are the courses. Again, I think there's even some more that aren't on here. If any of these cities look good to you, just type in the city name, right, course, and the city name, and Eric will get a hold of you, and Eric will give you a discount if you for attending tonight's webinar. on this. So like I said, some of them are 2-day courses. Some of them, the 2-day courses have a hands-on portion. The 1-day courses are very interactive and very open to talking, but we're not actually delivering devices and so forth. So just get a hold of us, and no obligation. Just type in the course, and if it works out for you, you can get a discount for that. And looky there, Rich, we're
Right on
finished.
time, man.
Man, are we good or what? Look at that, 8:59, and there's how you get a hold of us. And we'll hang out here for a minute and answer other questions that are on here. So, any
Yeah,
questions you want to answer out loud?
my hands are sore, guy. I've
Yeah,
been
you've done.
typing, man. We had about 50 questions tonight, so that's good. You know, we love it when people get engaged in this and they get interested about doing this because I think it changes dentists' lives as much as it does we change our patients' lives. I mean, we just can't tell you how many dentists, you know, there's a lot of baby boomers out there and they're all looking to kind of, get out of dentistry but they don't want to go sit on the beach somewhere and rot away, right? I mean, they still want to remain active in this, and I think your model, guy, is very good. You sold your practice, and then you kept the dental sleep part of that, and you were able to work that just a couple of days a week and make a living until you met me and we started all this stuff. Now you don't ever get to rest, but
It was supposed to get life's supposed to get easier, but it's, you know what, it's exciting and it's enjoyable. And I hope that if nothing more, you all understand that we're passionate about this. We care about this underserved problem. Rich and I had a dinner about, I've got it written down, I think it was 8 or 9 years ago, and we were just discussing how frustrating it was that this problem has been around for so long and we're really not making any ground on it. And that's when we decided, what can we do to help? And somehow it turned into this, and we're just as passionate as we were 8 years or 9 years ago about it. We want dentists to get involved. We feel like there's a firm place for dentists to be involved and dental teams to be involved in helping identify patients who don't know they have this problem and then helping treat them. And that's where our sincere vision is, and as long as we stay true to that, we're going to get more and more people on board and solve this. Because and if anybody's going to be out, I'll mention too at going to Denver next week for
yeah,
the
that's right. The Academy of Dental Sleep Medicine meeting.
yeah, we'll be there. Come by and say hello to us in person. We have a booth, and I love it because, if you're there, you can talk to our other members. We'll have, dozens, if not hundreds of members there. I mean, there's usually just tons of people that are been using DS3 for 2 or 3, 4 years now, and it's great to get to meet the people in person and talk to them and hear stories about how it's changed their practice and how they enjoy being involved in dental sleep now. So make sure you come by and say hello to us if you're coming out there. So
Yeah, do you have the course slides again, Guy,
sure.
on that? Maybe we could put that up again. And I think our next Keller webinar is
June
June
28th.
28th. Yeah,
Let me back up to that. Is that what it says there? Yeah.
yeah.
Yeah, June 28th, and I'll go back to the courses for you.
Yeah, so go ahead and register for that, and we thank you guys for spending your evening with us. We're going to work to get this archived somewhere so that some of you that came in late and had some audio problems and things like that, you can watch it in its entirety, at that. And of course, as DS3, we archive these things, and you can watch them through those as well. So
Yeah, all the webinars we do are available to DS3 members at any time. We have a thing called Snoozle, which is a dedicated dental sleep search engine, and there's all kinds of articles, uh, written articles, videos, and every webinar we do, we put in there, and it's archived, and you can search for it as members. And we do every other week. Rich and I do a personal webinar for our members, which is driven by member questions. So they submit the questions up until the day before, and then we have a real informal, a lot more interaction. It's hard with hundreds of people on here to unmute people because it gets pretty unruly, but it's a smaller group, and you're able to talk back and forth, and we personally answer any questions that you have too. And if you're do a free trial, you're welcome to tune in for that as we have those as well. So
Yeah,
Any other
I have
questions
to
on there?
say, Guy, those online study clubs, we always learn something too, right? Because
I love doing them.
people are asking us questions, up until that week, and then we've got to do some research sometimes. I mean, we know a lot of this stuff because we've been doing it a long time, and we've been teaching dentists how to do it. But yeah, we lose something. Somebody had something in there too about snoozle, Guy, right? I mean, what we developed it through DS3. Jason came up with the name Snoozle, and that basically is a dental sleep medicine search engine that just has our answers in it. So somebody says, how do you make an EMA tighter?
Yep, you snoozle it.
Yeah, you snoozle it, and that's what we tell people. And then we have little videos in there, and we have tutorials, and there's, I think we're up to about 350 articles in there now, something like that. So every time we
Well,
get a question, is there
there's a
more than
good bit
that?
more than that in there. I'm
Okay.
adding them every day. So if you have questions, we just add them, and we've had it. It's really a worthwhile feature of DS3. We also have in-person meetings that are not on that list that are free to our members as well. So you get to come down to sunny Florida from wherever else you are. We're having one in the fall in September, and that's free for our members as well as a team member that they can bring with them. Non-members are welcome too. It's mostly team DS3 members that come. The non-DS3 members obviously have to pay for it. So yeah, if you do a free trial, you can go in there and snoozle whatever you want. You can look at the videos and the articles that are there, and we'll teach you how to access Snoozle if you do the free trial. So just type in free trial and you can check out Snoozle.
And last but not least, dentalsleepsolutions.com, you can always get a hold of us through there if you missed something or forgot to write it down or something like that. And we exist to help dentists succeed in dental sleep medicine, but nobody else out there does what we do. So we're happy that you guys spent your evening with us. Thank you very much, and we'll hope to see you in Denver. Please come and say hello, and we hope to help you any way that we can.
Absolutely. And I think that seems to be about all the questions. I'll leave that up for just another minute to make sure if anybody needs to get a hold of us. And for everybody who typed in free trial or a course, we will be in contact with you again to talk to you about whichever of those you put in, or if you put in both, we'll talk to you about both when we do that. So thanks everybody for your attention. We hope to have you on in the end of June 28th for the detailed version of screening and testing. All
All
right, I
right.
guess I'll end it here then. All right, thank you everybody.
Great job, Guy.
You
All
too.
right. We'll
Bye-bye.
see you guys. Have a good evening.